Good morning.
Good morning.
I'd like to start our lecture with telling you what children aren't. They are not perfect little beings just waiting to be screwed up by the parents. This is sort of the popular misconception of modern society, right? Kids are, by nature, out of balance. It's natural because they are afflicted by, I think, what modern physiology, they call something like non-parallel development, meaning that certain things develop too fast and other things develop too slow, and therefore they're out of whack until they grow into a balanced perspective. And Chinese medicine has recognized that for a long time. So we can really help to reduce the extremes of this disparity in development and really make childhood much more comfortable for everybody. But before we go into those specifics, I was speaking here. When was that? When was I here last?
It was March 1st and 2nd last year.
Last year, March 1st, 2nd, and I said to Andrew, I'd really like to lecture on pediatrics. It's really my specialty area. And he says, I don't know that people are that interested in treating kids, you know. Well, I've been sort of on a crusade for a long time to get people in Chinese medicine really interested in treating kids for a variety of reasons. First off, what modern medicine tends to do to children is often overly aggressive, and we can really do so much to prevent that. Secondly, there are a lot of things for which modern treatments just aren't useful. For example, in all of the I say that aren't useful, like all of the behavioral disorders that are so common today. Modern medicine's approach of using medications with kids. You know, I've practiced for so many years in San Diego. There were many classrooms in San Diego where 60% of the kids were medicated. 60% of the kids in one classroom medicated. Something's not correct there. We really can do a lot for that situation. But beyond, and something my old mentor, I had an old Korean mentor, a sixth-generation practitioner, he would always laugh when he would come to the States and treat people because he'd say, you people in America have no grandmothers. Because people would come and ask him things about parenting and child care and weaning kids and these and that kind of thing. He said, no one comes to me and asks me that in Korea. They go to their grandmother and ask them that. What should I feed my kid? When should I wean them? But people here don't have this. I mean, we can only look at the issues right now. I've seen several articles in the newspaper around breastfeeding, and all these lactation coaches and things are now coming online because people don't know how to breastfeed. In Korea, people just ask their grandmother what to do. You know that. So we don't have grandmothers. So part of what we're doing in Chinese medicine, we're becoming people's grandmothers again. You know, trying to maintain some of this sort of folk wisdom and how to manage kids, and everything isn't a medical emergency. But that's the perspective from working with the kids. There also is the perspective from your own practice. Kids are really well networked. Therefore, when you treat one child, you will get many of them, so it is a big practice builder. So from your own personal side, it's really good to treat kids. You'll end up treating a lot, and they're all in sports teams and play groups, and you get them all, right? So it's very, and plus, unlike most of your adult patients, kids change quickly. So it's such a joy to treat them. You see the results right away, and it's you know, so that makes it, and then they're fun. They come in, you play with them, you know, it's like your friends coming to visit. You know, they don't come in, I'm depressed. They never say that, you know, right? So, you know, so there's a lot of reasons to treat kids. And so I say, I've been on sort of a crusade. So I sort of laughed when Andrew said, I don't think people are all that interested in treating kids anyway. Well, I tell you, I see by you all coming, you are interested. And if you haven't worked with kids very much, you're really going to like it in your practice. And you can really do so much good work in this field. So that's sort of just the little intro to pediatrics. So we're going to try to balance out these inherently unbalanced little beings. And remember, they're not perfect beings, but they're not small adults either. So if you try to treat them based on strictly adult principles of treatment, you don't get the results you'd expect a lot of times. I have a story I always love to tell about this because it's been many years ago now. I had a good friend who was we actually started practicing together. We opened an office together after we got out of training back in 1979. And then he went to China and studied for many years, and he became very fluent in Chinese. You know, the way to become most fluent in a language is you have a significant other of that culture, right? So he married a Chinese woman, and his Chinese became perfect, and he started doing a lot of translation. So I always looked to him as kind of an authority on many subjects because of it. But I was all the while, meanwhile, treating kids. So one day he came to me and said, you know, I'm having really struggling with this kid with recurrent ear infections, and I've tried all the normal stuff I do, and it's just not responding. The ear infections just keep recurring. And I asked him what he'd use, and he told me which herb formula he was prescribing. And I said, oh, why didn't you start with Shao Chai Hutang, minor bupleurum formula? And he's like, because that doesn't match the pattern. I said, no, you have to try Shao Chai Hutang. Oh, no, that's wrong. Okay. Well, I saw him again then some months later, and almost irritated, he says to me, I did try that, and it worked. Well, even though he was so knowledgeable, he wasn't thinking with a pediatric perspective when he was diagnosing the child. So he didn't see that, in fact, the correct formula was Shao Chai Hutang, even though the child didn't have the adult characteristics that you'd expect for that formula. So this was, you can't be rigid about applying your adult model. So we're going to begin this morning with the basic characteristics of what a child is. And I always say that if you remember this part, you can do everything in pediatrics. You don't need all this very detailed specifics. It's these basic principles of what a child is and balancing those that's going to get you the main results in your pediatric cases. I sometimes start this lecture one way and sometimes start the other. Sometimes I start with just talking about the development of the child, but I think today we'll just jump into these special factors of what a child is. So this is on the second page of your handout packet, page 2. Now I put on there some representative herb formulas under each issue. And we'll talk about those herb formulas. We'll also talk about points and massage techniques and so forth. We will, in the weekend, go into such issues as how to get kids to take herbs and what the dosage is and how to do needling on kids. And we're going to learn the basic pediatric Tuina as well as the Japanese Shoni Shin this weekend. I think those of you who haven't studied with me before, my approach is always to try to empower people to do things. And so, for example, the Japanese Shoni Shin is something you're going to learn in about half an hour. And yet, I know there are people who teach seminars in Bali for weeks on Shoni Shin. Now, it's a good excuse to be in Bali, but I don't know what they could possibly talk about Shoni Shin for more than half an hour. I mean, there's nothing to it. You can all do it, and you don't need to go buy fancy tools to do it. You can do it. In fact, it's better if you don't have fancy tools to do Shoni Shin. I actually have a set of Shoni Shin tools just because I'm teaching lectures on it, but I would never use them clinically. First off, the kids steal them from you, and then you have to buy them again, and they're expensive. Secondly, they kind of scare the kids because they don't know what they are. It's much better to do the Shoni Shin with just average stuff, whether it's forks and spoons or little toys or whatever. After all it is a massage tool, right? And so we will learn to do Shoni Shin, and it will be very effective for you. In fact, is a very good preventative maintenance thing. Takes only about 10 minutes clinically to apply. You can do it on a once-a-month basis during the flu seasons or whatever, and kids get a huge benefit. Even the Japanese government did a study on this, and they started to pay for kids to get Shoni Shin because they found they had fewer upper respiratory infections and missed school less often. So these are really useful tools that you can learn very fast. And so we're going to go through all those things. So don't worry in this first little introduction here as I go through, use this herb formula or use these points. We will come back to how to actually apply that. But first, let's learn what the aspects of the child that we have to consider in treatment, what those aspects are. First off, kids are vulnerable to external evils. The reason they're vulnerable to external evils is because, the reason, in fact, that they're vulnerable to many of these aspects is that children by nature have a weak qi-ji. You know this Chinese term qi-ji, qi machine? You know, some people like to say chi mechanism because machine. The chi mechanism, the chi machine of a child is undeveloped. In fact, it's so undeveloped, they don't even have all their meridians freely flowing yet. We know that the meridians don't achieve full free flow until puberty. This is when the Chongmai and the Renmai finally penetrate through, and then you're finally fertile. Of course, boys can actually father children at a younger age, but that's very taxing to their kidney. This is why you see many traditional herb formulas to be given to very young boys if they have to father a child. For example, this was the emperors. When an emperor was, it was very dangerous to be an emperor and not to have a male heir, because then people would like to knock off the emperor because that would create this whole issue of succession. And so the emperors, you know, sometimes a young male would ascend to the throne and would have to try to father a child. This was very depleting to the kidney. Why? Because they were actually trying to put forth that jing before their meridians were free-flowing. So children have a very weak qi mechanism. They can't raise wei qi to the surface very well. And this qi, let's think about this for just a second. I'm going to take this slide off and just write on here a few things. When we talk about the so-called the qi ji, one important part of that is the wei qi balancing with the yin qi on the interior. So the yin and wei balancing is very important. Kids can't do this very well. So we have to be very concerned with getting the wei qi up to the surface, protecting their interior. The yin qi on the interior doesn't circulate very well, so we have to really invigorate and make the qi circulate. For example, children should never have cold spots on their body. If you touch a child anywhere and it feels cold, by warming it up, you will be doing therapy for them. Now, of course, we can be more precise about this and say kids who have cold hands and feet typically have liver qi stagnation. Kids who have cold butts typically have kidney deficiency. Kids who have cold abdomens typically have spleen deficiency. But you don't have to think about that. You don't have to think about what does it mean. You have to think, when I touch a child and I find a cold spot, I'm going to just warm it up. And already, you will redistribute the yin qi, and the child will be better off for it. And so this is a very simple technique, doesn't require any diagnosis really except touching them, and then whatever method you want to use to warm them up. You could do Moxa, you could do frictioning massage. I have a special tool for this. This is excellent. Also, it is not scary to children, because even young kids are familiar with this at home. They think you're crazy because now you're blowing this on their butt or their back or whatever, but it's really therapeutic. And, you know, unlike taking out the Moxa stick and kind of scaring them with that, this works really well. So this is something we'll get into as we progress here, of how to, it's really the failing I see in a lot of the written materials available to us on Chinese medicine pediatrics. They always jump into, here's the disorder, and then here's the syndrome differentiation. But they forgot to talk about, well, how do I approach the child, and how do I work with the parents, and all of that stuff that really makes your treatment possible, even, right? So this is something we're gonna put some attention to this weekend. But for the technical details, we can say the yin qi tends to clump up and get stagnant in the body in kids, and if we can always, this is why not just warming up cold spots, but just touching them a lot all over their body is therapy. We know this from kids who have developmental disorders. Simply increasing the amount of physical stimulation doesn't, again, have to be some fancy Tuina technique, but just touching them all over circulates the qi that has a tendency to become stagnant, and they benefit. Their development is enhanced by that. You know, this is when we're talking about practice, though, this is an area to really work in, and you'll get so much input for developmentally challenged kids, especially kids who have been drug exposed in utero and stuff. I had an experience many years ago back in San Diego. I was treating a social worker for a problem of her own, And we started talking about kids, and she began to refer to me then a lot of drug-exposed kids, whose mothers had used various drugs during pregnancy, and the kids that the reaction to the treatment was so profound. It really enhanced their development, and really I think it didn't have anything to do with any advanced knowledge of Chinese medicine. It was just that increased stimulus. It really promotes that development. So this is the first part of our qi dish. We have to balance the yin and the wei. Now, for those of you herbalists in the class, I would ask, what is the basic herb formula in Chinese medicine that balances the yin and the wei? Guizhitang, of course. So guizhitang is a primary formula in pediatrics, very useful, particularly in kids who have a characteristic appearance. That appearance is a little pale, a little cold, a little tired. When you see a kid who looks like that, you know guizhitang, very simple, not bad tasting, safe to use for a long time, is a fundamental formula for this. It helps to enhance that yin-wei balance in kids. Now, another aspect of this qi ji has to do with the spleen and stomach. The spleen is in charge of ascending force and the stomach in charge of descending force in the body. This is very weak also in children. The stomach's descending force is weak. Therefore, kids tend to have a lot of reflux and burping up, and right? Similarly, because this descending force is weak, not only does the stuff come up the top, things don't want to come out the bottom, and we see constipation very often, especially in very young children. It's very useful and so we will see a lot of the, what do you learn in your adult treatment? Oh, we should see where the evil is located and always provoke the clearing from that level. So if we see an external evil penetrating and it's still very much on the surface, the attitude in adults is we have to push it back out through the surface. We can't purge it out because that makes it go deeper. But we don't have to worry about that in kids. Because they have this very weak descending function, it's always helpful to eliminate and clean the intestines in kids. So formulas, we often include treatment. This is why a kid with a high fever, parent will call you and say, and of course it's 11 at night and they're calling and they're saying, oh, my kid has this really high fever. I never give them Tylenol. What should I do? And I always ask if they had a bowel movement. If not, if you can provoke a bowel movement, either by abdominal rubbing or even use a little more aggressive method like using a glycerin suppository, that often purges the evil out of the child, even though the evil was right at the surface. Very useful technique. And you can go just to any supermarket, get a glycerin suppository that's the right size for, they have infant size, toddler size, and you just put that in and warn the parent when you put that in, it's coming right back out, and then the fever comes out. And you've actually purged heat from the yang ming, is sort of technically what we've done. But why does it work in kids even when it's at the surface? Because you're just restoring the normal function of their qi machine. You're creating that normal movement again. Now similarly, the spleen has to lift. Kids have, by nature, very undeveloped spleens. They have problems with lifting force in this way. Where does this show up a lot? How about something like bedwetting? How does bedwetting relate to the spleen? Because the force of the spleen is not ascending, therefore fluids come out too easily, but more importantly, the clear yang doesn't get to the brain and they can't wake up. You always ever notice how hard it is to wake kids up compared to adults? That's because they have weak spleens. In general, people with weak spleens can't wake up. This is true in adults too, right? You're groggy, you're heavy-headed, you have heavy eyes and all of that. That's one type of difficulty waking. Another type, of course, is liver stagnation. We see that in adults a lot. You can't wake them up because the liver won't release blood. But a lot of times, especially when you see the person has that spleen-natured appearance, they're a little heavy, they're a little puffy, they can't wake up. It's their spleen qi that's not lifting the clear yang to keep the brain active. So that's another important part of the chi mechanism in kids that's not functioning well. Now, another part of the general chi mechanism is focused on the liver, as it has to spread the chi. By nature, kids have a very big liver. We're going to look at this later when we get to diagnosis. In fact, I put it in your packet. You don't have to look for it. I'll just stick a slide here and we'll see it later. But there's a diagram of an infant's abdomen, and you can see the liver is giant, going from one side of the abdomen to the other. This slide didn't copy real clear, but you'll see here it says the greater curvature of the stomach is right here. We talk about wood overacting on earth or liver invading the stomach. It is physically happening in an infant. The stomach is totally compressed by the liver. Now, from a modern biomedical perspective, kids need such a big liver because their blood cells have a very short life in the body. Therefore, they break down quickly. The liver has to clean up all that waste product. If they didn't have that big liver, they'd be in trouble. But because they have that big liver, it produces all kinds of disorders as well. They tend to get liver chi stagnation very easily. They're really prone to liver excesses. And they really get stuck in liver phases of development. We're going to talk about this later, and so forth. So part of their chi mechanism not working is that the liver doesn't spread chi very well. It tends to become very constrained. I should mention, when we're working with the spleen dropping, of course we have herb formulas like a bujang ichitang that lift the spleen. But very often, we use a more general formula to just help the spleen chi. The most popular one is Lijiang. Lijiang Tang is strengthen the middle or regulate the middle. So some people call it Renshen Tang, ginseng formula. It's basically ginseng and ginger, right? And so why is this useful? The ginger helps prevent that reflux of the stomach so much, as well as having the benefit of warming the spleen. So in a sense, ginseng and ginger helps the downward action to make the stomach chi descend, as the ginseng is helping the upward movement of the spleen chi. So anyway, this is just a little background. The kids have this weak chi ji, this weak chi mechanism, and so we're trying to restore that in our treatment, and so we're concerned, they're very vulnerable to external evil. Now, another part of this vulnerability to the surface is they have by nature weak metal phase, weak lungs. This has to do with metal being the phase, the element that creates the separation between self and other. We talk about the Shen, the part of the mind that's in the lungs as the po. That is the connection of your mind to your own body, right? As opposed to the hun, the part of your Shen that's in the liver, is about you connecting outward to others. So problems with the liver result in relationship disorders. You can't relate to other people very well. You see this when kids are stuck in a wood liver aspect of development. They like to do parallel play, and they don't play well with other kids. They always taking stuff from them. Very characteristic behavior of kids stuck in the liver phase. They're grabbing everything from other kids, and all the other kids are upset. Right? That's a liver. You know you have to regulate that child's liver. We're going to talk about this more in detail, so you'll see, because before kids are capable of playing with each other, they have to make this movement out of wood into fire phase. That makes them outward going and interested in other people. That's the nature of fire. It moves outward. So if your kid is stuck in the wood phase and yet he's old enough to go to kindergarten, he doesn't perform well there. He doesn't get along with the other kids. He's not cooperative in the group activities of the kid in the kindergarten. You say, maybe he's just not ready yet. For, some people stay stuck in that phase their whole life and they never play well with others. And then, they usually become politicians, I find, So it's true, because you enjoy telling others what, you think you know what's best for everybody else when you're stuck in that phase, right? Whereas fire, you know, can you imagine that teenagers are also in a fire phase? That's why they're only interested in their friends, right? It's all about outward relationship at that time. So we'll look at this. Anyway, kids have this weakness of the lungs, weakness of metal, especially when they're first born. They don't even know that the whole world isn't part of them. You know, that's why they just cry and stuff happens to them. You know, hopefully good stuff. You know, their mother feeds them or whatever. They're in this metal phase. And so they're trying to develop this separation from the outside environment. So this makes them particularly vulnerable to external evils. Therefore, we should always consider when treating a child, do I need to clear any external evils? Maybe we'll see direct symptoms of it in terms of fever, in terms of mucus drainage, in terms of lymph swelling. Maybe we only suspect it because the problems that they're having only appeared after they had an external evil. Very common thing we see clinically. Kids will come in with whatever disorder, can be even behavioral disorders, can be hyperactivity or whatever. But the parent will give you a clue and say, these things came up after the kid was sick with a febrile disorder. You better guess that there is probably some lingering pathogen, lingering evil in that child, and clear that. In fact, you will cure many cases of hyperactivity if you do that. Without calming the heart, without clearing the liver, just clearing the external evil is often enough in that case. That gets rid of the obstructing phlegm, that gets rid of this sort of excessive fire that's being generated in the body. So it's so important to keep in mind, kids are vulnerable to evils, and if you have any suspicion that one is present, you better treat that. Yes?
Just, are you talking herbally, acupuncture, both? Do you have
any way.
Okay.
Now, my habit clinically is always to do combined treatment. I treat kids with acupuncture, I do Tuina or Shoni Shin, and then I give them herbs. That's just what I do because I think I like that combined approach. It makes it possible for me to see kids less often. I do it with adults too. It makes it possible to see them less often, and yet they're having the support of the herbs at home. If I'm doing hand technique, and we're going to look at some other techniques like using a cutaneous electric stim on kids, it lets me do a lot of points that otherwise I wouldn't needle. You know, there's a lot of points I like to use, but you know, you have to decide, do I really want to push through and needle those face points and stuff? Sometimes that's important, but a lot of times, you know, you'll see kids with these lingering evils in their sinuses, for example. And you'll know, oh, there's a lingering evil in the sinus. I want to treat that spot. It's hard to needle kids' face. Even kids who are cooperative with needling, it's a little bit, you know, sort of close in somehow. I'll pull out my cutaneous electric stim and just put it on there. And big green snot comes out their nose right there. Oh, you know you opened up that impacted area of the sinus. You know, so it's nice to have these multiple approaches to use. So I'm using all these techniques, but if you suspect the evil is there, better focus on it. So now the first formula that I put on here is Bayingdan. Bayingdan is often translated as the baby protector. This formula is has fairly unusual ingredients for a child, would seem unusual for a child. And it's representative of an important principle in pediatric herbalism. You can use strong-natured herbs with kids. You just use them in a small dose. Don't think that, oh, I should always use only the mildest kinds of herbs with children. Kids have extreme aspects to their conditions. You see it, right? They get a fever, it gets really hot, really fast, or whatever. So they have that extreme nature. They're just small. And so we can use those extreme herbs, we just use them in a tiny amount. So I put Bayingdan here because it's real representative of this using kind of stronger herbs than you might expect. Bayingdan actually has two basic components. It has Dananxing, the herb Dananxing, which we know as an herb that really unbinds phlegm from the body, right? it's really an interesting, representative of an interesting point, isn't it? That when you treat something with bile, hence the dan here, the herb normally is called tiannanxing, right? Tiannanxing is the herb, and then you process it with bile. They cook it with pig's bile. And it makes it much more phlegm clearing. So we have the rule that bile cuts phlegm. And this is true in any way we engage with a person, a patient, an adult, a child, or whatever. If we activate their gallbladder, we help eliminate phlegm from the body. Maybe you study that stomach 40 is one of your premier points for clearing substantial phlegm. When phlegm is coming out somewhere from the nose or wherever, if you add stomach 40 into your point prescription, it's going to reduce phlegm. My old Korean mentor would always say, but you know, you can treat stomach 40 with bile. You add gallbladder 34. And when you put these two together, it's much stronger phlegm clearing. So he would say, this is the same as processing tiannanxing with bile. You're adding the gallbladder activation to stomach 40, and now it even promotes more discharge of phlegm. There's a very interesting treatment specific to pediatrics, is using the siphon points, these 4 creases. And stimulating these points activates the gallbladder. You know that it activates the gallbladder because it changes the child's stool. The stool becomes very greenish color, indicating the presence of elevated bile salts when you stimulate these points. In fact, I always tell the parent, if I use these points, watch for this effect. Watch your child's stool and see if it changes. Because typically, here I'm speaking about young kids, they'll often have that more yellowish, mustardy colored stool, right? And you stimulate these points, the stool should darken. That's a good sign. The treatment was helpful, and they will reduce phlegm as a result. They're actually discharging phlegm out through the digestive system, discharging food accumulation and so forth. So you're using this principle of cutting phlegm by adding bile.
So you're saying using the siphon points when the stools tend to be green, or that it will make...
No, it will make them green, and that's a therapeutic sign. That's a good thing, not a bad thing. And in fact, sometimes if there's a lot of food retention, there'll be the stool will take on a funny odor or something like that, and the parent will report back to you that that's the case. And so you hope to hear that, because then you know you've actually had a strong clearing effect by using those points. I'll say right here, I know we haven't talked about treating points yet, but I'll say right here, you don't have to, prick these points. You don't have to express yellow fluid or any of that other stuff that you sometimes hear about, the siphon points. Even nipping kind of technique where you use your nail to press strongly on those points can be strong enough in many cases to really provoke this elimination. So that's something to include very typically in your treatment, is the siphon points. We digress to that from the Baoying Dan, saying that its main herb is dananxing. I think I might have I made a copy of this formula out of the patent medicine book that's back there from Jake. Here you see that this formula has dananxing as its main ingredient, and then you see that 2 follow, Tuinxie, Jiangshan. Right away you see, oh my God, they're putting scorpion in there and a kid's formula. Of course, extreme herb, small doses, it's no problem. Parents don't know what that is, so it's... By the way, I've never found a kid that minded when I told them that there were things like, scorpion or snake in their herbs. But parents seem to mind. It kind of creeps them out. The kids think, what's the difference? It all tastes bad to me, so I don't care what it is. And then, so you see, the main herb is dananxing, and then these two, plus the Baifuzha, actually form the second part. I don't know why they listed it further down. I guess just because the amount is less. But those 3 are that formula called lead to symmetry powder, usually used for things like facial paralysis. It opens the orifices, doesn't it? It really has a strong expelling effect. So this formula is we're going to clear by resolving phlegm obstruction and then opening the orifices to push everything out. That's the notion here. And this is I tell you, this is such an important formula because I educate parents to keep it on hand at home and give it at the first sign of any kind of evil. It will typically stop the development of the problem. I tell you, once parents learn about this and start using it, they don't know how they got along without it before. Because I tell you, mothers particularly are expert at diagnosing the Shin. They always are like, I could see it in my kid's eye that they were getting sick, right? They can see that little moistening of the eye that tends to start up when kids are catching an external evil or something. I mean, parents in general, they're familiar with how their kid moves and acts, and so they're good at visual diagnosis like this, way better than you are, because you're just meeting the kid, you don't know quite what their nature is. Parents pick up these, so if they have Baying Dan at home, and as soon as they see that, they give it typically 1 or at most 2 doses, the kid is better, and they get way less external evil issues. Yes?
How young do you use this?
No bottom limit.
Really?
Yeah. Again, you're using a small dosage. This comes packaged in individual doses. And I would use that individual dose as it comes prepackaged down to about 6 months. Younger than 6 months, I tend to use a half the packaged dose. So you could use it, even in an infant, at about half the normal dose. Yeah.
Did you mention that it's considered illegal in California, this formula?
I didn't say that.
Okay. I don't know if it still is, but I thought it might be important to know.
Yes, the reason is because, as it says on there, is because of the Bing Pien in there. And California deals with Bing Pien as if it's camphor. And so it is a kind of a natural form of cancer and less toxic. And again, the dosage is quite small. So the amount that they're going to get, I mean, it's just almost a vapor of it in there. And it's really, we would know that it's not a particular concern. But the very fact that it's listed on the label freaks out the Food and Drug Board in California, and therefore, however, it's commonly available at the herb stores because, as you know, things get shipped in big cartons, and only every once in a while the customs look at it, and so a lot of times it makes it in. It does make it harder to get through your established herb suppliers. They don't, but if you go to so the next time you're in any Chinatown, you can just go and buy several boxes, and then you just have it on hand. Is the easy way to cope with that issue. Yeah.
So these packages you're talking about are from a particular company, or? There
are many brands, as is typical with patent medicines, and I can't say that I have one favorite brand or something. I don't even remember. The one I buy, it comes in a metal can, and there's probably about 10 doses in it. And I usually give just individual doses to parents, like the 2 little packs of the individual dose, and it's a powder. They would and then I tell them, the first sign your kid is getting sick, give them a dose, and then give them another dose that evening. Or if it's already evening, another dose in the morning. So they give them 2 doses. If they don't respond, call me, and then we decide what to do. Usually, if this formula is going to work, it's going to work like that, because it's a strong exterior releasing through opening the orifices formula. And so if that's not working, then we have to reevaluate. Really what it means probably is that the formula is stronger than what the child needs. This is, I think, an interesting principle that many practitioners overlook. You have to match the force of exterior releasing to the force of the external evil coming in. This is why when we look at our classics like the Shanghun Lun, he goes through this whole thing of like we mentioned Guizhi a minute ago. Then there's Ma Huang Tang, and then there's several combinations where you're getting more and more Ma Huang or more. He's balancing, trying to find the force that you need to match the force of the evil. Then it really clears it. If you go too strong, it sort of goes right past the evil. So as I say, if the parent calls me and says, I gave them 2 doses, they're still getting sick. Fever's coming up, snot's coming out, okay, bring them in. And usually I'll give a formula that's actually not expressing through the orifices then a more surface-releasing formula. The standard is the second one on our list, Gogentang. Gogentang is a very intermediate force formula, sort of halfway between Ma Huang Tang and Guizhitang. It also has additional benefit. The Gogen harmonizes the digestive system, which is another aspect of what kids are. So Gogentang is the second formula listed, because when Banyingdan doesn't work, usually because it's a little too dramatic, Gogentang is typically the right choice. Now, we very, very seldom give straight Gogentang to children because they get so hot, and Gogentang is a somewhat warm formula. The standard variation in classical pediatrics, classical Chinese medicine pediatrics, is to add Huang Qin. So Gogentang plus Huang Qin is the way that formula is used in children. It's not what I do in clinical practice. I instead mix Gogentang with the formula called Chuan Xin Lian, with the same rationale. But rather than choosing Huang Qin, which in the more classic discussions, they tend to use it more as a kind of a general heat and damp, heat and toxin clearing, I like to go a little more to the toxins. And the Chuan Xin Lian formula does that. The Chuan Xin Lian formula is really only 3 herbs. It has the herb that's named Chuan Xin Lian, it has Ban Len Gun, and it has Pugong Yin. And these 3 herbs are chosen because they are said to clear heat and toxin from the 3 warmers. I mix Gogentang and Chuan Xin Lian, and I really like this with kids because Ban Len Gun, number 1, kills strep. And kids often have issues of strep. You know, they always have, even if they haven't been diagnosed as having strep, kids with these recurrent swollen lymph nodes and stuff, there's often some low-grade lingering strep issue, Kids always, then they get impetigo on the skin, with yellow crusty stuff on their nose or lip from, that's strep growing in there. Then they want to give you a hug, and always, So then you take some Chuan Xin Lian, just, the Pugong Yin, it also clears the skin level a lot, and the kids benefit from that. So I like to do this. So you can either go with the classical approach or try using the, and there's a rule when you're using these kind of classical formulas like Gogentang. It's better to make modifications by addition than make modifications by subtraction. The reason being, these classical formulas, fairly small number of ingredients, are always concerned with establishing the Qi-Ji. And you typically disrupt that when you take herbs out. I mean, Zhang Zhenjing, he was so concerned when he wrote the Shangli, he was so concerned with that. All of his formulas are that way. If you look at them, they all have herbs going in 2 directions. He always does that because he's trying to reestablish the Qi mechanism. So you mentioned Guizhitang is the first one. But you think about most of his formulas, especially formulas dealing with toxins and evils and stuff like that, they always have 2 directions. We mentioned Xiao Chai Hu Tang a minute ago. We're going to come to that formula. How about that one? It's got Blue Plurum, which is warm, versus Huang Qin, which is cold. It's got Blue Plurum, which is moving up and out. It's got Ren Shen bringing qi in the interior. It's always about that kind of. He always loves that. That you see it a lot later in the Jingui, like when he has all those formulas for B syndromes. He always puts hot and cold herbs in them. Even for hot B syndromes, he has a bunch of cold herbs to treat the hot B, and then he puts in Futsa or Wutou. What the heck? Well, that dual direction reestablishes the normal movement of qi, makes the qi circulate correctly. So this is why then the principle is it's better in classical formulas not to take stuff out, which is great for us because we like to use prepared herbs a lot with kids. So we don't have to worry about taking stuff out. We can just mix 2 formulas together. So you can have Chuan Xin Lian, you can have Gogentang, you mix them together, it's a perfect match for the kid. Now, I gave you some ideas about Baiying Dan as far as points, like using the Sifeng points, like using gallbladder 34 and stomach 40. Also, remember, it opens the orifices, and we can take that somewhat literally to say when kids have external evils, treat around the orifice through which that evil entered. Whether you do needling, whether you do cutaneous electric stim, whether you do hand technique of some kind or Shoni Shin, whatever it is, treating around that opening, even using a Moxa stick to circle the affected opening can be helpful because that activates the orifice. It helps the evil to go back out. As opposed to what we do when we're using a formula like Gogentang, which is more general surface releasing, and the Gogen particularly acts on this area, right? That's why it's so useful for when you have catch cold and stiff neck. Why is that an issue? Because this area is, there's the wind openings are there. You've got all those wind points. And so treating, when you use a Gogentang formula, you want to treat this region. So whether you use, again, acupuncture, whether you do cupping, whether you do light gua sha on kids in that region, helps reinforce the effect of the Gogentang to expel the evil out of their body. Of course, you could use the Chinese folk technique of where the mother sucks on that region and gives the kid a hickey. You know that thing you used to do in high school to each other's neck? You know, but you can't do that clinically to the kids. You could tell the mother to do that, but otherwise we actually just use cupping, you know. And with cupping with kids, we typically use quick cups, where you put the cup on and pop it right off. You don't retain the cup. It's on and off several times, and kids tend to, once they're familiar with this technique, I usually demonstrate it on my stomach first, which makes them laugh. So I pull up my shirt and pop it off a couple times. They think it's funny. I let them pull it off. Then I do it on them, and it's not intimidating. But that kind of quick cups is what we want, because we're not really trying to break up stagnation. We're trying to draw things out. And so the symbolic of that drawing out is the quick cup, putting it on and popping it off.
So no flame to suck out the oxygen type of...
Well, no, you make the flame and put on, pop it right back off. You put on, pop it off. And so you can either do flame cups, or if you have some kind of little pump thing, that's a little bit less threatening sometimes to the kids, because
to the parents.
Or to the parents, yeah. So, you know, it really is, just to touch on that issue for a moment, it really is a question of developing a sort of playful trust in the child, to where they're confident you're not going to do something. You know, I had a little guy some years ago that maybe you can help me. What's the name of that condition where the organs develop on the outside of the body? You know, and so then when the baby's born, they have to surgically put everything back. And so, you know, I don't remember the term for that. This little guy was that way. And then, of course, he had lots of issues, digestive problems, and a lot of it was due to adhesions that formed and all. And so they had done multiple surgeries through his young life. And so when he came to me, his mom said, "Oh, can you help with some of the issues he's having, with some of the ongoing pain and so forth?" He was quite fearful, you know, because he had treated so much with this kind of strong therapy in the past. And I said, "Oh, what we're going to do here is very comfortable. Nothing we're going to do is going to hurt." He goes, "They always say that." Right? So building trust is an issue, right? Because, you know, a lot of kids come to you after they've seen other medical practitioners. I tell you, I can tell. I pull out the otoscope to look in a kid's ear. If they go ballistic, I know they've been mishandled by some other practitioner. If I'm the first person who gets to do that, we have no problems. First off, I tell them it's a flashlight. I show them the light. I'm going to look in their ear. Where's your ear? I start looking around on their body, touching the otoscope to their knee. They think this is the stupidest adult I've ever met. He doesn't know that this is my ear. They present their body to me. I look in there. No problem. This is the key, right? I didn't hold him down, sit on his, like, I think I might have put in your packet a thing from one of the modern Western medical textbooks on how to use the otoscope. And it shows him, like, holding the kid down like this, right? To look in their ear. Why on earth would you do that? You know? every kid's familiar with a flashlight. It's not threatening. I'm looking for their ear. They say, here's my ear. I look in there. No problem. Then they want to look in your ear. Never let them. They stick it in too far. Let them look in their mother's ear. You know, her eyes bulge out as they push the otoscope. But it's not a big deal. But what happens is they go to a pediatrician who tends to be in a hurry, he's more interested in the diagnosis than he is in relating to the child, and he jams the otoscope in, it's uncomfortable, and they're freaked out from the get-go. So you pull that thing out, now it's got this whole trust issue to build. When kids know me and all, I can burn Moxa, I can do flame cupping and all this. It's not a problem. But at first, or if they've been, aggressively handled by other practitioners or whatever, then you might adopt an approach. Like, even we use Moxa. I don't like to stand there, this smokeless smoke. By that time they start to get like, I'd rather light it, very casually over here, not make a big production, A lot of your treatment, we will see as we do the needling, is sort of sleight of hand. You're distracting with big movements while you do small movements, and they hardly pay attention to what you're doing. So we'll get back to that. However, the issue is when we're using the Goguen tongue, we want to make sure we treat the wind points in the upper back area, and then we also want to follow the idea of the Goguen tongue and harmonize the digestive system. So whether you add abdominal rubbing or do points on the abdomen, my favorite points to include here are the simple ones like Ren 12 and Stomach 25. The move points for the stomach and intestines. And really that moves the intestine in this case, and it sort of enhances the Goguen tongue effect. It's no surprise, is it, that Goguen is so useful in kids that they even make Goguen candy in Japan. Right, just give it to kids. You can also use kudzu powder that you buy at the health food store to harmonize the interior, to reestablish the chi flow. It's a very therapeutic thing with kids. The way it's typically done is you cook you mix some water and a little bit of fruit juice as a flavoring with the kudzu powder, and then bring it to a boil. And it makes almost like a little custard sort of thing. It thickens, and so you could choose a little bit of fruit juice that the kid likes and mix it. Usually the ratio is probably about 1 cup of liquid to about a tablespoon of the kudzu powder. And that's very useful to give the kids to regulate their digestion, and just kind of helps their wei qi. So that's the first issue. The kids are particularly vulnerable to external evils. And then the second issue is that those evils then become lingering in their body. I mentioned this already. If you have any suspicion that there's some impact by an external evil, you better treat that. And really, I think that this is compounded by our modern circumstances of vaccinating kids, of using antibiotics a lot with kids and so forth. You get more of these lingering evils as a result. Antibiotics are quite good at suppressing the acute external evil heat generation, but they don't clear the... We see this as a real problem, don't we? That when you take antibiotics, you tend to get resistant organisms. The Chinese medical notion around this is that antibiotics are like treating exclusively with heat clearers without adding any surface releasing or purging kind of treatment. So you're suppressing the heat of the reaction to the external evil without clearing it from the body. It's a very cold substance, but it doesn't, and because we would never do that herbally, right? We would never say, oh, let's just give heat clearers, but we're not going to do any kind of, surface releasing.
Considered a heat clearer, or just trying to add cold to the heat?
The question he's asking me is, are antibiotics more like gypsum, or are they more like Bonlin gun? Does it really somehow denature the virus? Does it really kill the bacteria? Or does it just suppress the heat? We do know from our modern studies, though, that antibiotics reduce your own antibody production. So it's no wonder that we see in kids who have a lot of antibiotics lingering evils. For example, I had a little guy come in, he was on a 6-month prophylactic dose of antibiotics for recurrent ear infections. That's a strategy sometimes used, right? So after 6 months, and he had no ear infections during those 6 months, but after ending that, within a few weeks, an ear infection reappeared. So that's what provoked his parents to bring him to me. I mean, his dad was an MD, not a pediatrician, and so it was a leap for his dad to bring him in. But he was clearly dissatisfied after 6 months of this prophylactic dose for, right? So you would say that in this case, I wouldn't say that it's just because the antibiotics didn't kill some, because we know in recurrent ear infections, food retention is a big component of that. The stomach and intestines have an internal pathway that reaches the ear, and the food retention causes that damp to go up to the ear. And so until you clear the food retention, and antibiotics being cold medicines often make that problem worse. Yeah.
When you have kids that come in with that have had this type of antibiotic use, do you use probiotics or suggest probiotics? Is that part of your treatment protocol?
Yeah. Although, of course, it's not standard Chinese medicine notion, right? It's sort of our modern overlay on that. But I think it's reasonable to give kids who have had a lot of antibiotic use some kind of support for their normal flora. So, and I might add, using some digestive enzymes is good with those kids. In fact, when you think this kid has phlegm, and part of the reason for the phlegm is due to their spleen being weak, adding some digestive enzymes for a short time, and you can buy digestive enzymes in a powder form, makes them easy to add to your herb formula. That really seems to be, in a sense, a spleen tonic phlegm transforming kind of aspect that you can add into your prescription.
Excuse me.
Yeah.
So, the MD's son, how did you treat him?
So as I say, in his case, there's two aspects to it. One is clearing the lingering pathogen. And so here we see the main formula is Xiaochaihutan for lingering pathogens. Now we're going to get into this in a little bit of detail in a second. So I gave him the Xiaochaihutan, but I also worked on clearing food retention in the stomach. I thought that was, in his case, and there was other evidence of that, tended to have a thick coating on the tongue, tended to have poor appetite. And now, of course, you would say, I would expect after 6 months of antibiotics use, you'd have a poor appetite. But so you want to add a spleen tonification to that. In that case, I used something simple. I used Liujunzatang, the 6 gentleman formula. And that's a common, that's a standard combination I use is Xiaochaihutan and Liujunzatang together. The Chenpi and the Bansha, in that you're actually now having a bigger dose of Bansha because you have it in both formulas. So when you mix those two formulas together, you get a little more of that clearing of that retention in the middle. Stronger choice would be Shenling Baijusan, the ginseng and attract the lotus formula. Shenling Baijusan is something I prescribe a lot in pediatrics. Even when you don't see all the obvious phlegm, but you want to, that formula increases appetite. The coolest thing about Shenling Baijusan in pediatrics is it tends to increase the range of foods that kids like. I always say this formula makes mothers happy. Because mothers are spleens, after all. Dads are livers. That's what they say classically. Yeah, I mean, of course, these days, roles are blurred and everybody does everything in childcare and all of that. But speaking in a sort of iconic way, we can say that discipline, control, those kind of aspects, think back to the days when wait till your father gets home was sort of the mantra. that's the liver aspect. So issues around discipline and like that affects the child's liver. Excessive discipline creates liver fire. Kids tend to explode when there's excessive control and discipline. When the structure and pressure is too great, kids will often act out in an aggressive way. On the other hand, lack of discipline produces liver qi stagnation. We commonly see this in the modern world. Often when I say this in a class, people are like, how can that be? Lack of discipline produces liver qi stagnation. The child doesn't have clear boundaries. And when they don't get boundaries placed on them, it's a kind of insecurity comes inside, and it actually creates an internal constraint. And I see this very often in behavioral disorders in kids. When you see kids who are attention deficit, hyperactive, and you begin to really observe the interaction with the parents, they have no boundaries, no discipline, no sense of what correct. These are the kids that tend to respond to these strategies that teachers often use, like they start to have very clear behavioral contracts with the kids. These are the behaviors I expect. This is what will happen if you don't do them. This is what you'll get if you do them. They have a whole... And those kids respond well to that because that's what they are craving, is some kind of orderly structure that makes the liver relax. Suddenly their liver qi stagnation goes away. Of course, you can give them, Igan-san. Igan-san is a variation of Chayo-san. And Igan-san is the best for that kind of mild liver stagnation. Kids are now misbehaving. Let me finish this issue then of the pathogens becoming lingering. So we see here, I'm sorry, I was talking about that kid. Was that clear, kind of the idea of what I did with him,
Yeah,
right?
excuse me, the one question was, so Chai Hutong and Jinzatong or Shenling Bajutong?
Oh, no, not or. I was just saying similar to Liu-Junzatong, but maybe a little stronger for its phlegm and food retention clearing is Shenling Baijusan. I didn't use it in his case, but that's another possibility.
But you wouldn't use it instead of the combination, you would use it...
I might use it,
alternate.
I might mix it with Shao Chai Hutong,
Oh.
because the Shao Chai Hutong, the Chai Hu in it is having a double benefit here. It's still releasing that evil, and it's moving the liver stagnation. So you want those aspects included in there.
Would you use like a Lijiang formulas in any variation?
Yeah, the reason I wouldn't, Lijiang, we mentioned Lijiang Tong a minute ago, that Lijiang has the ginger in it, which is warming and helps to send reflux, but it doesn't have the Chen Pi or the Bansha that helps the accumulated aspect. So you have to decide, is this kid more cold digestion?
More warming for the...
Right. And so if they have cold spleen stuff, cold abdomen, for example, they may wake up with diarrhea. And you touch their abdomen, it feels really cold. That's a common thing we experience. That's where your Lijiang formula is more appropriate. Again, it goes back to our thing about kids should never be cold. You find very often kids who wake up in the morning, because after all, they're excess yang deficient yin. And so they go to bed and they throw off all the covers. And they pull off their clothes and they sleep like that. Right? People who sleep extended like that have internal heat. But then they have weak spleens underneath of that. And so now the cold penetrates because the temperature drops at night. Then the kids wake up with all these cold disorders of their spleen and stomach, often pain, cramping, diarrhea, whatever, and you touch the abdomen and it feels cold. And that's where you can use the Lijiang type formulas. Or you can do Moxa on Ren 12, or you can give, the classic treatment is to put a hot rice plaster. You cook rice like you're baking it to eat. When it's ready, you scoop it out on a cloth and put it on the abdomen. The idea there is you get the heat of the rice plus the gu qi, the grain qi, goes in and strengthens the spleen. I don't know if it's really, it's magic, so. But that's, at least you see the idea, right? The idea is to put heat and qi into the abdomen. Whether a hot rice plaster is actually better than a heating pad or a Moxa, I don't know. But that's the classic idea there, Well, hey, let's take a break. When we come back, I'm going to go through a strategy then for just clearing the lingering pathogen.